Hey everybody, Dr. Sean Hill here. This article came across my feed fairly recently, and I shared it on our stories. Had some questions about it, and so I kind of wanted to discuss it a little bit more. Okay, so essentially, what happened? This is from the LA Times, as you can see up there, and basically, this 8-year-old mother of four flew from Las Vegas to LA to have liposuction performed on her by what she thought was a board certified surgeon. And so, from what they described, this facility, it was in a strip mall, and basically the patient went into what sounds like cardiac arrest. CPR was performed and the patient passed. This, as much as this article, it's terrible, and people ask me all the time, Dr. Hill, don't people know about these things, or don't we check these things out? And frankly, it's happens more often than you think. It happens in more places than you think. I mean, down here in Dallas, for example, I know for a fact that there are people within a few miles of my office here, who are not plastic surgeons that are doing these procedures in their office. And so your question is, well, how can these people do these things? And so let's kind of do a little bit of synopsis here. So plastic surgeons are board certified by the American Board of Plastic Surgery. So the American Board of Plastic Surgery is a member of the American Board of Medical Specialties. What does that mean? Basically, this is the governing body over all different accredited training programs to make sure that people that are training in whatever they train in get consistent training, that they are committed to, that the training programs themselves are accredited. They police the training programs to make sure that everything is uniform, and that we're putting out safe physicians. Okay, so the American Board of Medical Specialties comprises all the things from general surgery, plastic surgery, orthopedic surgery, pediatrics, family medicine, etc. Okay. This doctor was probably saying that they were a board certified cosmetic surgeon. Now, what's the difference? Cosmetic surgery is basically, it is not accredited by the American Board of Medical Specialties. And the reason being is the training to become a, quote, cosmetic surgeon is basically not consistent across the country. The people that are doing these things are most likely not even surgeons. I mean, for example, this is a pediatrician. I've heard of OB-GYN physicians doing cosmetic surgery, family medicine doctors, emergency medicine physicians. They're all basically doing cosmetic surgery despite the fact that they have not gone through an accredited training program to do these procedures. The American Board of Plastic Surgery and plastic surgeons are the only physicians that are actually accredited by the American Board of Medical Specialties to perform cosmetic surgery. So you need to make sure that when you look up a physician that may be doing cosmetic surgery on you, make sure that they're actually board certified by the American Board of Plastic Surgery. The American Board of Cosmetic Surgery essentially is a piece of paper hanging on the wall that is worthless, okay? So yes, there are people that are doing these things in our own backyard, and yes, we need to police it better. And the thing about it is these people or these articles come out, and these physicians aren't really outed until something bad happens, which is the worst part about it. Certain states have tried to enforce these things. Now, the other thing too to mention is to be credentialed at a accredited surgery center or hospital to do cosmetic procedures, you have to be board eligible or certified by the American Board of Plastic Surgeons. So this doctor was doing these things basically under local anesthetic in a back room in their office, because they can't do these things at hospitals or accredited surgery centers. And so thus, I am accredited or credentialed at various hospitals across the area. So heaven forbid, if I'm working at a surgery center or in the hospital or any hospital, my patients can get admitted to the hospital to be taken care of. Whereas this physician, if these patients had gone to the hospital, who knows who would have been taking care of them. And so basically, another thing you can ask your potential surgeon is, number one, are you board certified by the American Board of Plastic Surgeons? But where do we do the procedures at? Because if it's under just numbing medicine in their office, they may only be doing all their procedures like breast augmentations, facelifts, tummy tucks in their office like that, because they can't do it anywhere else. And so just make sure you do your homework, man, because your health is important. These stories are terrible. As a plastic surgeon, certified by the American Board of Plastic Surgeons, this makes us look bad, And so y'all just do your homework. Again, Dr. Sean Hill here. This article is in the LA Times, and so you can read it there. And I probably will do a blog on it too. So if you want a little bit more of it on that. Anyway, take care, everyone.